Your passcode has been confirmed. You will be joined in listen-only mode.
In a more aligned, collaborative way so that we're able to align our own internal operations so that we can add more value to the communities that we live and work in. And the third principle is an idea of nurturing a culture of collaboration. So how we as the Park Service can be better partners for the nonprofit organizations, the businesses, and the citizens living in our cities across the country. So two of the primary ways that we're working to activate the urban agenda are first through the 10 model cities that we have selected, and each city has an urban fellow that's working to advance this coherent system of national parks, programs, and partnerships. And the second way that we're working on activating the urban agenda is through this Urban Matters national network that you all are a part of. And so we're trying to bring people together to a shared space just to talk about the different urban work that they're engaged in and shine light on some of the leaders across the service and beyond the Park Service so that we can ultimately try to reach a broader audience and be really engaged with the people that visit our parks and take part in our programs. That's just a brief overview of the Park Service Urban Agenda, and you can learn more at nps.gov/urban. And the webinar today is a way for us to bring the urban community together with the health community to explore what we're all working on together and to try to build a broader network of folks that are working in cities or in rural areas connecting with urban residents. So I'll let Kristin Wheeler from the Institute at the Golden Gate take it from there.
Great, thanks so much, Elle. So like Elle said, I'm Kristin Wheeler. I'm the Associate Director at the Institute at the Golden Gate in San Francisco. We are a nonprofit partner of the National Park Service, and over the last few years, we've worked to convene leaders from the park and health movements to make sure that we're amplifying one another's work and looking for new solutions to not only improve the health and well-being of our individuals and our populations as a whole, but really showing that parks can serve and be of value to all Americans. So there's some really nice intersections with the urban agenda. And so over the next hour, you're going to get to hear from various speakers and case studies from across the country to share their lessons learned about their park health partnerships and programming. So to start us off today, we're going to hear from Captain Sara Newman, Director of the National Park Service, Office of Public Health, as well as Diana Allen, Chief of Health Promotion and Healthy Parks, Healthy People under the Office of Public Health. After that, we'll hear from Dr. Robert Zarr, a pediatrician at Unity Health, who many of you might have heard of, better known as Nature Doc. After Dr. Zarr, we'll hear from Lance Hatten and Alicia Scott. Lance is Superintendent at John Lafitte National Historical Park and Preserve and New Orleans Jazz National Historical Park. Alicia Scott is Interpretive Supervisor at John Lafitte. So after that, we'll have time for questions and answers. As questions start popping up over the webinar, please feel free to put that into the chat function. We'll start to collect those so we can best answer as many as possible at the end of this webinar. And then we'll wrap it up with our call to action and next steps. So now I'm going to pass things over to Captain Sara Newman to kick us off.
Thank you very much, Kristin. I'm really excited to be here for this opportunity. Most exciting for me is to learn from my colleagues about the really incredible work they're doing already to promote and utilize our parks as health resources. For me, this convergence of urbanization and urban matters with health has personal meaning. I got my master's in city planning, and then I went on to get a doctorate in public health. So, and one of the foundations of city planning was the public health movement. So it's been clear to me since I began to really engage in my education that urbanization is a determinant of health. So I'm just real excited to be here and talk to you more about what we're doing. So I'm going to see here how I change the slides. It looks a little different than it did before. See if this works. Sorry, folks. Okay. So until about the end of the 19th century, the United States government really had no concern about public health matters at all. I mean, that might surprise you, but modern public health developed out of the impact of industrialization. So with a major increase in immigration and urban growth in about the mid-1800s, when we began to see disease associated with environmental conditions, including air and water and garbage and congested living, this produced recurring epidemics. You know, you'll remember, you know, your history, smallpox, typhoid, typhus, cholera, yellow fever, and that really resulted in an urgent need for public health and a public health response. So whereas before public health was sort of a local responsibility, this urban phenomenon led to the sanitary reform movement, which is really the public health movement, and it became a widespread concern for the federal government and government bodies, and that's when we saw the beginning of public health. Really what it was, the essence of urbanization made public health a moral imperative. And so that was then, and what about now? And, you know, so now, for the first time in the history, the majority of the population, as was just mentioned, live in urban areas. In the United States alone, 80% of our population live in urban areas. And while urban environments provide great opportunities, as we all know, access to jobs, accessible food sources, culture and recreation, there are also continue to be challenges, environmental challenges, challenges to ensure safe water reaches folks, violence, injury, and still non-communicable diseases. But, you know, there's another element of what's happening now is that urban environments now provide an opportunity to promote healthy behaviors and promote safety, and an opportunity to design cities to promote physical activity, to offer green space, to provide better health services, to make healthy food affordable, to increase road safety. So I'm excited about being here and marrying these two really critical areas. And, you know, it's exciting that we're doing it here on our federal lands. You know, the National Park Service and the Department of Interior has been dedicated to public health since really the beginnings of the National Park Service. In 1921, the first director of the National Park Service asked our U.S. Surgeon General to assign someone from the PHS as a sanitary engineer who would work out of San Francisco. So since that time to this day, the two organizations, the U.S. Public Health Service and the National Park Service, have enjoyed a partnership that's actually said to be one of the oldest agreements between two federal agencies in the government. I'm the director, as Kristin said, of the Office of Public Health. Our office represents the largest public health capacity in the Department of Interior. We really function as a unique internal health department, protecting really more than 300 million people, employees, through protection, prevention, and health promotion. And we partner and collaborate. You know, there are 50 health service officers, but folks like Diana Allen, who's part of this Office of Public Health, and others who are non-commissioned officers but work in close collaboration, just as we do in the United States government, officers in uniform working with our civil servants in partnership to really put forth and to promote and protect our population. Our officers and our civilian service, Park Service employees and Department of Interior employees who work in public health come from a variety of areas: medical, environmental health, nursing, veterinary medicine, engineering, science. So we cover such a wide range. In our Office of Public Health, what we do is we provide on-site evaluations of our operations, water, wastewater, and food, to prevent disease spread, so to protect our visitors and actually our employees, to ensure, just like we did early on, the whole movement of public health was to protect people from unsafe water and to ensure that food was clean. And so we do that right here in the National Park Service. We also have an epidemiology program where we conduct disease surveillance and response. I have an officer who actually left today to do an outbreak investigation at one of our parks. So we have much work to do both in protection and prevention. But another element of what we do, which is exciting and what we're talking about today really, is health promotion activities. And Diana Allen leads she's the chief of our health promotion. She serves really as the center for the National Park Service Healthy Parks, Healthy People program, and she'll be talking to you about that today. Before I turn it to Diane, I do want to talk to you about some of the other roles we have in the Office of Public Health. One is that we sit on the National Prevention Council, again, along with our work in health promotion. And it's tasked with promoting the Surgeon General's strategy for improved health and wellness for our citizens. And that includes healthy eating, active living, injury and violence-free living, mental and emotional well-being, all the things that we're doing in the many programs you'll hear about today to improve health and well-being. Last month, our U.S. Surgeon General, Rear Admiral Vivek Murthy, and his picture's right here, released his call to action on walking and walkable communities. And this is really something that resonates with me, and I hope with you, in terms of the potential of what we can do in our parks and our public lands to promote this call to action, because this plan is based on scientific evidence, and it provides rationale not just for walking because walking is affordable. It's usually, and it should be, safe, it's accessible, it can be done by people who can't even walk. So it doesn't eliminate people who can't walk, but it includes people who are in wheelchairs or need to use other modes to move around. But what we know in this scientific release is that there's clear evidence that walking has great impacts on health, and that because many of our citizens, 1 out of 2 adults have chronic diseases, many of much of our population don't meet physical fitness guidelines. Here's an opportunity for us to really promote something on our federal lands for people who can use our parks as their backyard for walking, and open spaces and green spaces as their backyard. So I'm going to turn over to Diana, but my last message is, back in the 1800s, early 1900s, there was a moral imperative to bring health to our urban areas. And I think now we're in a new moral imperative. We have a new revolution, which is wellness. And while much of our urban areas are livable and better to live in, they really do provide opportunities to improve and promote our health. And so that's what you'll hear about today. If there's anything here that interests you in terms of the work that we're doing in the Office of Public Health, please don't hesitate to contact me. I'm so excited by the fact that all of you are on the phone today, and I hope what you'll think about is when you hear some of the things you'll hear today, think about what you'll next do. What are you going to do with that information? Are you going to get engaged? Are you going to create your own sort of initiative in your park or your federal land or within your domain to push forth some of these ideas? Are you going to get involved? So I hope that's something you'll think about as we move along here. Thanks much, Kristin. And now I'm going to pass this over to Diana.
Thank you, Sara.
Thank you.
Welcome, everyone. I see we have hundreds of people on the call from the Forest Service and the Park Service. I just want to welcome everyone and acknowledge that many of you are already working in this element because it's fast becoming part of our culture. We see it in the newspapers, we hear it on the radio, we see it in our own parks and public lands. So I think I just want to acknowledge we're all learning together, and I'm really pleased to be on the call to share some perspectives nationally and how we're framing up healthy parks, healthy people as a way to advance our work together collectively, so we can all drive success and we can all claim success collectively. So I think Sara didn't speak to these 2 slides. This is information that's coming out of Healthy Parks, Healthy People evidence report, State of the Evidence for 2015, and it's available online. And essentially what we continue to find is a strong base of evidence connecting parks and health and looking at the whole lifespan. So from the cradle to the grave, connecting people to nature is going to extend their lifespan and extend their quality of life. And the Park Service is making health promotion a piece of our Find Your Park campaign. So some of you may have seen the videos and the promotions and ways we're looking at reaching to millennials, but also reaching to seniors. So as we look to Healthy Parks, Healthy People, just defining it, it's a global movement that's coming out of Parks Victoria, Australia. And Parks Victoria, Australia coined the term, and we've adopted it in the U.S. National Park Service, and it's been adopted in over 100 nations globally, with 35 of them implementing specific practices. We'll be publishing a best practice guideline series as part of the Conservation Congress in 2016, and it looks at many of the things that are happening in our cities across the globe and our communities, connecting to people, to nature, and culture for their health. So when we think about healthy parks, healthy people, I just want to underscore how we define our parks as health resources. So we've looked closely at the science, and we've actually coined the phrase park health resources being the sum total of our natural and cultural resources that can provide physical, mental, spiritual, and social benefits to people. So we can begin to examine holistically how our parks are a habitat for healthy living, and how we can grow new habits of behavior and grow new environments, new policies and programs that support a healthy park experience. So in our cities, we're seeing lots of programs emerge, and so I've been real intentional about showing some examples that will just drill down quickly to see how policies, programs, and environments come together as health resources in our parks. And so we're seeing this in terms of recreation, when we connect people to our parks, and people are finding community in nature, and we're being more invitational. So the relevance can come when people realize that our parks and our public lands are places they can have fun, and they can find what we call self-help. So sometimes we don't even have to be super intentional about having something be healthy, and we can also just be invitational. So we're seeing, I'll give you a few examples of some programs that I think we're looking at have a lot of opportunity for expansion and are just getting traction and momentum. One would be just simply yoga and Tai Chi events in our parks on a regular basis. They don't have much impact on the natural resource, and they're very restorative and very popular. Another is concert series. We have a Healthy Parks, Healthy People concert series that's grown out of the National Mall with assistance from Daryl Haley, who is with Howard University Radio in DC. He will be taking his concert series across the country in 2016. So many of folks on the line will be encouraged to consider whether you might be in a position to host a concert. It's these concerts are put on by veterans and youth. So we work closely with the Veterans Association, and these programs are designed, they bring restoration and healing to the artists as they give their music back to the community. They're healed, and the communities are healed in so doing. So that's an innovative program. We have some evaluation coming out of Penn State, really looking at the impact of this on people's lives. We're really saving lives through this program. Feet in the Street is another program that's an example of open streets. We're seeing open streets in Latin America, Europe, here in the United States and Canada, Central Park. Many of our national parks are closing streets to automobiles and opening them to pedestrians and bicyclists and festival activities. So again, this is a way to be invitational to physical activity, restoration, and connections in our parks, which translates into people being more healthy, happy, and whole. So even just closing down a roadway temporarily on a weekend or a few hours in the morning can have an impact in the community. Another program we're seeing gaining traction is the Summer Trek series with Girl Trek. So that's walking clubs in our cities where African women and girls are being invitational to create these walking clubs in the spirit of Harriet Tubman, and recognizing that for your own health and well-being and transformation, that walking on a regular basis can be the basis for that and the basis for new health. So these walking clubs across the country, and we partner with the National Park Service to find national parks near them. So one example would be there can be walking clubs in Detroit, and the walking club then are invited to experience Indiana Dunes, which is, within a day's drive, where then they are opened up to a more natural experience and they're rewarded. So lots of opportunities connecting cities to national parks, connecting new audiences to restoration and healing in fresh and inviting ways. Another example I wanted to share is Gateway to Parque to Salud. So as we think of our parks as gateways to health, I think this is a really good example where we're partnering with the American Heart Association in the parks to create health ambassadors with youth. So youth learn healthy habits for themselves, and then they come up with programming to invite the community in to connect in the park. So that's a program that translates into changed behaviors for the park ambassadors and within the community itself. They have a certificate of completion program and strong partnership with the American Heart Association that can translate into health throughout the community. And then I just want to touch on a couple of the other pillars. We think of healthy recreation in our parks, which has been the basis of most of what I've spoken about up to now. Healthy foods is another aspect of Healthy Parks, Healthy People, and it involves policy, it involves park environments, and it involves programming. So we do have a policy that calls for new concessions to provide healthy, sustainable food. But then even in many of our parks, there's opportunities where we have farming within the park. We also have community gardens. We're seeing this new movement of urban farming. So these are innovative ways that we can actually bring healthy foods into any of our activities in the park. And then finally, healthy parks partnerships. We're seeing in Healthy Parks, Healthy People, we've really encouraged experimentation with our parks and our programs, and we have hundreds now of examples of these partnerships all across the country. One of the most exciting that's emerged is park prescriptions, and we're seeing various iterations of this. And I will be turning this over to Dr. Zarr to share some of his on-the-ground experience as a pediatrician with this, and really looking forward to hearing some more in depth on how some of these programs are being put to work in our communities. So with that, I'm going to turn it, Kristin, do I turn it over directly to you and then to Dr. Zarr?
Right back to me would be great. Thanks, Diana.
Okay, sure.
Well, great. Thank you so much, Captain Newman and Diana, for shedding some light on the breadth and depth of work that's already occurring throughout the Park Service and filling us in on the history of public health and the parks in the last century. So to tell us more about the clinical perspective and what's happening from a medical perspective is Dr. Robert Zarr. So again, Dr. Robert Zarr is a pediatrician. There's a picture of him there, actually, at Unity Health, which is a federally qualified health center in Washington, D.C. He's also the founder and director of D.C. Park Prescription, and is going to be talking about that program. I'm going to turn it over to Robert now.
Great, thanks, Kristin, and thanks you all for everybody for inviting me to be on the call. So I'm going to give you a quick overview of what we've been able to accomplish here in the nation's capital, and I hope as a inspiration and as a potential, prototype, so to speak, of what can be done, I think, in most urban areas. As Dr. Newman mentioned earlier, we have a growing urban population. We'll have about 70% of our world's population living in an urban area by 2030, and these billions of people are suffering from chronic disease, which is why I've labeled this set of slides, fighting chronic disease with nature. And out of curiosity here, if anybody listened to NPR yesterday, there was an interesting article about PTSD and the effects of yoga, and I think it ties nicely into what we've been doing here with parks and chronic disease, which really includes a large category of mental health and even PTSD. So the next slide is about chronic disease burden, and as I mentioned earlier, we've got a growing epidemic in this country. So 1 in 3 Americans right now suffers from a chronic disease. This spans the age from childhood to adulthood, and I've listed a number of different conditions. This is not all-inclusive, but these are the ones that are talked about most often in the literature. In addition to that, there's always sort of this obvious connection, I think, to the lack of activity with with lack of exercise and activity and walking with overweight and obesity. And obesity and overweight, I just want to point out, is an independent risk factor for chronic disease. So that in and of itself is a very serious condition, not really necessarily a diagnosis, but a condition, not necessarily a chronic disease, but a condition. And, what does chronic disease mean for, 100 million Americans? Well, it means a decreased quality of life and ultimately premature death. So these are some pretty heavy things to be talking about at 1 o'clock Eastern Standard Time. Spending time in natural environments is important. I think Dr. Newman mentioned the importance of walking, and walking definitely is the single most important thing and probably the easiest thing we can do to improve our health. But we know that walking outside, especially in green space, is even more dramatic in terms of its health effects. So it's not just about decreasing obesity anymore. So the next slide really sort of defines, a phrase, what is DC Park Rx? And people often ask me, so what exactly are you doing in DC? And I think the best way I can describe it is it's a community health initiative. So it's not just me prescribing parks. The effort that went into play here was, lots of individuals, lots of organizations from those providing health care to the parks, providing us with the green space, to hospitals, to insurance companies, to the federal government, to local government, to DC Park and Rec, and you'll see on my next slide, this is this huge list of all these different organizations who are responsible. But we all came together because we believe that we can change chronic disease, and we can also create the next generation of environmental stewards by the nature simply of prescribing parks, especially in an office setting. So my next slide, as I mentioned earlier, has a list of some of the partners. These are not all, but these are some of the ones that come to mind when I think of what we've been able to accomplish here in DC. So what have we actually accomplished is the next slide. I would say, I've tried to boil it down just a few bullets here, but, we had to go about finding a tool that was standardized for us to look at the space, the green space, and to see, how does it compare, how does one park compare to the other, and what's there, how to get there. And so we did that. We used a park rating tool, standardized one, a couple of them actually, and we mapped out all the space and we rated all these parks. And we have somewhere in the order of about 350 parks we've rated. And we were able to do this miraculously through lots of volunteers who mostly were students in the public health school. And it seemed very fitting actually for them to do this. It fit nicely with their program work. And they were very enthusiastic about going and visiting the parks and following a standardized rating tool, which I trained them to use, or a colleague of mine at the Department of Health did, and then they created these summaries, which you'll see in just a second. So we developed this massive list of all these parks, and you'll see what they look like in just a second, and we call them a park page. So a park summary is a park page, and we've linked them to the electronic medical record at Unity Healthcare, where I currently am staff. And I've been here about 14 years, and we have about 180 different providers, doctors, and other clinicians who are able to prescribe parks now. We see about 100,000. We have about 100,000 patients, and we see about over 500,000 visits a year. So we're the single largest, provider of care, especially to the poor and underserved in our region. We launched this in July of 2013, so now over 2 years, and we prescribed over 750 prescriptions so far. We did a little bit of research, a little outcomes research, looking at behavioral changes in 2013, and I'll get to that in just a second. So next slide kind of gives you a quick glimpse as to what I see when I'm in my, a patient's electronic health record and I'm prescribing a park. So it links to this page here where you're looking at. It's got all the zip codes in DC. And you can imagine this could be done where you are too. It's not complicated at all. And you can either type in the zip code or you can click on the zip code. You can search by, the zip code itself or a certain amount of radius, mileage radius around it, 0.5 to 5 mile radius. And then, so you can do this, depends on where the patient works or, where they're more willing and where the person's more willing or able to be active, let's say to be in a green space. It might be, around their work area. If they're an adult, it might be, near their school. If they're a kid, it might be near their home. So wherever they think that would be the most feasible place for them to actually be active is where you would put the zip code in. And then you would pull up a next slide. You'll see this is an example. The Petworth Recreation Center is one of our many, many, many parks. And we've given a really easy one-pager for every park. So every park has a corresponding park page, and they have the name of the park. We've got the owner and manager of the parks. In this case, it's the D.C. Department of Park and Rec, and obviously if it's like Rock Creek, it'll be National Park Service. On the left, you'll see some symbols that are pretty universal, and then under that, you'll see some information, just basic stuff like hours, from dawn to dusk, and contact information if it exists, information about pets, how to get there in terms of walking, bus, parking, etc. We really, really encourage our patients to walk there. The point of this is to walk, as Dr. Newman had mentioned. We give some grades, and you can see in the top middle section for cleanliness, which is a really important thing to most of our people that we prescribe parks to. They want, is it a clean place to go? Is it, full of garbage, or, is it tidy? So is it well maintained? Accessibility is a big one. So is it relatively easy to get to? Is it, only some place that you would have to drive to, et cetera? And then we have something called exercise, or the next rendition will be activity level rather than exercise level. And make sure that our doctors and our patients know what is there to do there. Is there equipment there? Is there a track there? What kinds of things are there in terms of other activities that scheduled activities that occur there? Where is that level of activity for them in that park? We have a map underneath that. We've got things to do. Things to do I personally like, and it seems like the other doctors around here like too, because it's just a real quick way to kind of see one glance what's happening at that park. And then below that we have more detailed information. And people do ask about safety all the time, and it is there in the bottom central section. You'll see say safety, and that question comes up quite a bit. So there's a lot of detail, but not an overwhelming amount. And it seems from both our patients and our doctors using this now for over 2 years, they seem to like it. When we have a picture, we put a picture on the bottom left as well, and that's sort of a wonderful way to grab the attention of the kids, especially in the office, asking their parents to take them right after the visit. So the next slide, going back to this idea of doing research and evaluation, we did some research in 2013, and it was amazing to me, how well it was received by both our patients and the doctors. The research was focused particularly on children, and technical reasons for that. We had an approval from an institutional review board at a children's hospital, so we were focusing on children at the time. But once again, we prescribe parks to any age. So it was greatly received, positively received, and as you can see on the slide, there was an increase in the number of parents who really believe that physical activity or activity is good for the health of their child. And I was personally concerned about the adoption rate. Maybe it wouldn't be accepted by a lot of the providers. We have a lot of competing, priorities during the visit, from infectious disease to developmental screenings to immunization checks to other chronic disease management. So there's a lot of things you have to sort of juggle during a visit, and the real estate is very expensive, frankly, in terms of your time. What we did find out was that if a child was prescribed a park in this format, through a doctor's office, receiving a park page or a couple of park pages, and it was prescribed usually by a trusted provider, a healthcare provider or clinician, that person would spend 22 more minutes per week on physical activity. So that's significant in terms of looking at statistics and analysis. This has a good p-value and a good confidence interval. So these are some something that you could really, you know, write home about. The second is that if a child was prescribed a park, that he or she would spend 6 more days per year at a park for at least 30 minutes. This is if it were extrapolated out over the course of a year. Now, obviously, you know, depending on where you are, you know, the weather drastically changes, you know, throughout the year. And for those of us who live in areas where we have cold winters and really hot summers, seasonality might play a bigger issue into this willingness to be outside. However, having said that, I know in D.C., and I'm not sure if this is true for all urban areas, and it'll be interesting to see as we march forward and spread this concept throughout the country, you know, whether in fact these green areas are linked to indoor recreation centers. So if the weather really is quite inclement, it's very useful to know that there is a place just right next to that green area, and to really associate, you know, staying active with a general area that's close to you, it's convenient, accessible, safe, etc., that has both indoor and outdoor. Why are they relevant? This is my next slide. Well, it's cheap. I mean, a lot of the park space exists. Now, not every city has enough, so there are park deserts. But by and large, you will find good green space in most urban areas. So it's trusted. These are areas that are generally trusted. Of course, you know, some parks, even in D.C., you know, do have a reputation of being slightly dangerous, and we've labeled those parks on there. So we're working to clean up these areas and make them feel safe and be safe for the entire population. And it's accessible. So, you know, and that's a goal I know for the Park Service. It's a goal for the Institute at the Golden Gate. It's a goal for anybody working in this arena, is to make sure that the park space, green space, is accessible. So in a place where we have it, you know, we know that we can definitely change health outcomes for our population by prescribing parks and getting our patients outside. And as I mentioned earlier, this happens in large part, I think, because there's a good relationship between a patient and his or her doctor. So, you know, this advice is taken quite seriously, and in my experience and those of my colleagues, it's been really eye-opening to see everybody, you know, practicing this kind of sort of wellness medicine. So the next slide is a quick look at, you know, where we're headed fairly soon, actually. We're kind of in the process of doing some of this already now. So we'd like to expand this. Of course, we'd love, you know, more cities around the country and more superintendents of parks, managers of parks to team up and to find out who were those champions, those leaders in your cities, and have the meetings that we had and organize amongst yourselves and rate the parks, map them, and then link them to the current practice of clinics where you practice medicine and hospitals, et cetera, and start prescribing parks. So programmatic expansion is one of our, you know, really important sort of next steps. The second for us is going to be functionality, so search functionality. So right now, as I showed you, if you go to that previous slide, you don't have to, but if you were to scroll back, Kristin, to show them the zip code search, you know, that's the only way we can search right now, but very soon, within the next few months, we're going to be able to search by activities, by location, by park benches, by lighting, by safety, and you can, you know, use a number of different variables to search. So you can really narrow down your search very specifically for, you know, your needs, for your patient, you know, your patient's needs. And soon we'll have apps on our phones for this as well, and that's important because once they leave the office, they don't have the doctor right there to look it up for them. Although the website is accessible right now to the public, we want it to be on the phones because we know that mobile devices are just so popular, and almost everybody, rich or poor, has them now, that once they can download that app, then they can look and see right then and there wherever they want to do, whatever they want to do, and wherever they want to be, and really match the perfect park for themselves. And then lastly, we need to do more research. You know, this isn't on like my most urgent, but it is urgent that we have a good sense whether prescribing parks actually, for an individual that is, reduces blood pressure, reduces measures of diabetic control, improves measures of diabetic control, reduces your body mass index, in other words, you're overweight and obese. So these are really important things that we need to show, which we haven't shown with a randomized controlled trial, with, you know, something something that we could publish in, one of our scientific journals, that most of our health providers read across the country. So there's I don't know if we can, Kristin, if you can give them a little glimpse of what this looks like in the future. If you can, great. There is a Park RX, a Park prescription program in Williamsburg at William and Mary College, a colleague of ours down there. And I wanted to, if it's possible to pull that up, that's great. If not, no worries. But it's a glimpse into what our website here is going to look like pretty soon in terms of its search functionality. So my last slide just has my affiliations where I work. Once again, I'm at Unity Healthcare, and we're an example of a very large community health center, otherwise a federally qualified health center, which is a number of different sites around the city. And we are increasing in terms of, a type of healthcare setting around the country. So these kinds of settings are increasing in number, and more Americans are using them. We're probably somewhere in the orders of 20-something million Americans are using community health centers for their primary care and specialty care too. With the increase in coverage with ACA, the Affordable Care Act, we're seeing more Americans now able to see a doctor, and they are often coming to community health centers. So this is a very important population to reach for obvious reasons, because they are at higher risk, being low income, being underserved as a population, and better served and best served by spending more time outdoor in nature. So thank you again, and I forget who I'm passing the baton on. I think, is it Lance? But I think, Kristin, you can probably do that for me.
Sure. Thanks so much, Dr. Zarr. And apologies, everybody. We're having some technical difficulties on the slides. Seems to have crashed the slides. So we're working to get those back up, so bear with us. But I am going to pass it to Lance Hatten and Alicia Scott at Jean Lafitte in New Orleans to get us started. If you guys just want to start talking about your work in New Orleans, and we'll start working on getting the slides back up. Thank you all so much for your patience with this.
Yes, good afternoon, and thanks to everyone for dialing in. We're really happy to be a part of this panel to share some of the lessons that we've learned from our Healthy Parks, Healthy People programs here at Jean Lafitte National Historical Park and Preserve and New Orleans Jazz National Historical Park. I'm Lance Hatten, Park Superintendent.
And I'm Acting Chief of Interpretation, Alicia Scott.
This afternoon, we're going to talk to you about the lessons that we have learned from our program. The staff at both of our sites developed ambitious Healthy Parks, Healthy People programs. Our approaches that we took centered on our unique park spaces, the services we offer, and they were designed to get urban residents outside to play, explore nature, and dance together to the music of life in southern Louisiana. I think we may have the slides almost going back up, so we're going to try to advance. You all can bear with us.
Go ahead and put like 20 in, and then. Okay, so before we could embark on a program here at Jean Lafitte and Jazz, we needed to educate ourselves about the prevalent health issues that plague the communities we serve in this state. No surprise from Dr. Zarr's slides, but type 2 diabetes and obesity are a big problem in Louisiana, caused primarily by sedentary lifestyles coupled with unhealthy eating habits. So these statistics underscore what we're up against when we're trying to get people outside and get them active.
Collaboration with partners was key to our success. Our partners increased our capacity to fund transportation, to provide training, and they helped us build strong patient support networks. We worked together with partners to better understand challenges and to develop smart ways to address the health needs for the populations that we serve. The partners that we work with included the National Park Foundation, medical professionals and pediatric staff from local hospitals to include Ochsner Hospital, West Jefferson Medical Center, and Tulane University's LaSalle Clinic. We also work with the National Environmental Education Foundation, and nothing is successful without getting the word out. So we work with a local television station, WDSU.
Let's see. So what kind of programs manifested themselves out of this desire to have more Healthy Parks, Healthy People programming in our parks? First, we put together an annual health event at Barataria Preserve, our big nature site that's part of Jean Lafitte, called Better Health by You. So it's in the bayou, but it's also a play on words, Better Health by You. We also, the jazz staff, put together a Let's Move Outside video that I hope you guys got to view in preparation for this training. It's catchy. It's from the Songs for Junior Rangers CD. And then also, Jazz has monthly jazz yoga and jazz Pilates programs where people are playing live music and doing a yoga class at the same time. And it's definitely gotten a bit of a cult following here in the New Orleans area. There's a large group every month. And then something that is so new, it wasn't even on our slides if you could see them, is that it rolling out just this past month in September, 2 of our Acadian or Cajun cultural sites now have monthly farmers markets on park property, sharing that healthy food with the public that they serve in their community.
Now, we just heard about the Park Prescriptions program in Washington, D.C. Here, too, we have a Park Prescriptions program that got attending pediatric physicians, their patients, families, and friends to our outdoor spaces. We provided transportation, a healthy meal, and fun and interesting programs. They explored, the patients hiked, they canoed, they played, they danced, and they otherwise had fun in our park sites.
Awesome.
So you had seen on Diana's slide a graphic of the cover of the Healthy Parks, Healthy People e-guide. We were one of the parks featured in there. I definitely recommend checking out that guide. It showcases opportunities for innovation. It shows how parks are engaging underserved populations, and it emphasizes partnerships. And, you know, when you check it out, all of those parks featured, I guarantee you will find an example that you can easily set in motion at your park.
What we learned. This was not easy, and we learned that, firstly, we engaged new audiences. 90 to 95% of the people who visited our park sites had never been there before, so we're really excited about that. But we also realized that it's hard to keep them engaged. The other important lesson that we learned, or another important lesson that we learned, our park sites are spread throughout southern Louisiana. And it's important for us to have available free and easy transportation. For our Park Prescriptions program, we learned that physician trust, training, and participation proved invaluable. We also recognize that it's important to make it fun. You have to combine educational as well as recreational programs. Support was key. Support from the community, peer support helped participants tackle new challenges, as well as family support proved important to help willing and interested patients.
And then we can all appreciate it takes a village. So I want to thank all of the park staff and partners that have made our Healthy Parks, Healthy People programming happen at Jean Lafitte and Jazz, and to thank all of you for your attention.
Great, thank you so much, Lance and Alicia. Really appreciate that. Again, apologies for the technical difficulties we've had, but these slides will all be available, so you can get back in there in case you missed any of them. We'll be sure to send it out to all the participants. So we've got a few minutes left, and we had a couple of questions come in, so I want to make sure that we address those questions, and if you do have additional ones, please just start popping those into the chat box now, and we'll get to as many as possible. One quick question for Lance and Alicia that came in. If one of you could speak to how you were able to get a special use permit for the farmers market in your park.
Wow, that's a great question. That proved to be pretty simple. We work with several local providers, and they actually, under an umbrella permit, they grouped together and they had one person who submitted the special use permit. We have our normal processes where it goes on Pepsi, and we have our interdisciplinary team review it, and then it was forwarded to my office for approval.
Great, thanks, Lan. We have a question for Dr. Zarr. Dr. Zarr, how does a park get their programming information to you to be added into your park pages? And expanding upon that, what do you see as the expansion plan so that what you're doing in DC can kind of continue to grow out through the entire DC metro area?
Okay, so that's great. Two great questions. So sometimes, parks or people I meet who, either know about a park that's not on our database will let me know about it. But most of the information that we got in there, actually, as I mentioned earlier, was really driven by students. Some park rangers actually went out and rated parks as well with us. Some doctors did it with us, some medical students, and public health students I mentioned earlier. So that's where the information really came from, actually sending people out to parks once they were trained in order to use a very simple rating tool. And then that information was very easily uploaded into an electronic database. And then, myself or one of my volunteers, jointly looked at this information and created these park pages. So that's how really that process worked. Now, if somebody comes to me today and says, oh, there's another park I know of, it's on a database, we will, either ask that person to rate the park after, a quick training on how to use the database, the rating tool, or I, on occasion have some volunteers still who might be able to help with that. So that's how that happens. In terms of your second question about how to, get this spread, I'm glad you asked because I'm transitioning into a new role, both at Unity and for the Park Service, as well as the Institute of the Golden Gate, in being sort of a national, park RX ambassador, and part of that role is to, to be a technical support and to help collaborate, really further this idea and make it programmatic throughout the country. So I don't know that I can see whose question that was, but please feel free to reach out to me directly, and I'm sure that Kristin can share that my contact information with anybody who needs it on the call.
Great. Thanks so much, Dr. Zarr. And there was another follow-up question for you. I think people are kind of eager to see the rest of your park pages, so we'll make sure that that link and all those information, as well as
right.
Dr. Zarr's contact information, gets sent out. I did want to address another great question that we have coming in from actually one of our urban fellows here in Richmond, California, kind of talking about what involvement we have for HPHP programming that's not in a national park right now, but is more of a local area. And if anybody on the panel would like to speak to that. Otherwise, I'm sure I could probably chime in a little bit. Sara or Diana, would you like to speak to what's going on in more local areas, not directly in national parks around Healthy Parks, Healthy People?
Well, sure, this is Diana. I would say, everything we've touched upon is happening locally. And Kristin, I think you could speak to the San Francisco Bay Area. I think there's some local programming that's cropping up across the country, some statewide programming, some statewide park systems are, promoting this in various ways. So, wow, there's all manner of things that one could identify, everything from, Children's Bill of Rights, connecting children to nature for their health, or any of the programs we would have discussed. Park prescriptions is being adopted at the local, the regional, state levels, all across the country. So, yeah, I think we're seeing examples everywhere.
Great. Thanks, Diana. And I'll just quickly add to that and kind of wrap us up. Unfortunately, our time has come to a close. But, again, all the contact information for our panelists today, as well as mine, will be included in this webinar. So if you do have questions, please reach out to these subject matter experts. They're in the field kind of learning as they go, and I'm sure eager to share their lessons with all of you and vice versa. I'm sure many of you are putting on these health park partnerships in your own communities. So I just wanted to close and thank all of our panelists today for the work that they're doing in their field, for joining us today, and for all of you to joining us. And it's very clear that on both the quantitative and qualitative levels, we increasingly understand how more time outdoors does improve our well-being. There's a body of research that helps to demonstrate and validate that, not just for physical activity, but for depression, mental health, community resilience, and many other ailments. It's truly a win-win, especially if we continue to implement this work underneath the urban agenda, reach those new audiences, and create that next generation of park stewards, advocates, and leaders. So thank you all so much for joining us today. Again, this webinar is recorded, so you can see all of the slides and contact information. We'll do our best to continue to address some of the questions that are coming in through the chat function as well. So thank you all again so much for joining us. And with that, have a great rest of your day.
That does conclude today's conference call. We thank you all for participating. You may now disconnect and have a great rest of your day.